All right, let's jump right into a topic that's pretty much guaranteed to show up on your exams and, more importantly, is absolutely critical for keeping your patients safe. We're talking about corticosteroids. If you're serious about passing the NCLEX, you've got to know this stuff inside and out. So listen up, because this is your clinical alert.
Okay, right off the bat, this is it. This is the single most important life-saving rule you need to burn into your brain. I'm going to say it again. You never, ever stop corticosteroids suddenly. The dose has to be tapered down slowly. And look, this isn't just some nice suggestion. It's a hard and fast rule that prevents a complete disaster.
So, you're probably asking, why? What's the big deal? Well, the answer is a really dangerous condition called adrenal suppression. You see, when a patient is taking these drugs, their own body's adrenal glands basically go on vacation. They stop making their natural cortisol. If you suddenly pull the plug on the medication, their body is left with zero cortisol, which can cause their blood pressure to plummet, send them into shock, and yeah, it can even be fatal. This is a massive safety issue and, you guessed it, a major NCLEX topic.
To really get a handle on these drugs, we need to split them into their two major families, glucocorticoids and mineralocorticoids. Yeah, they sound kind of similar, but they have totally different jobs in the body. Knowing that difference is absolutely key. So let's break them down.
Okay, check this out. It's actually way simpler than it sounds. Just think of glucocorticoids as the body's firefighters. They're powerful anti-inflammatory and immunosuppressive agents. We use them for things like asthma, autoimmune diseases, you name it. Mineralocorticoids, on the other hand, they're the body's plumbers. Their main job is aldosterone replacement, which basically means they manage all the salt and water balance. Two different jobs, two different things you gotta watch out for.
Let's start with the real power players, the glucocorticoids. The two big names you're going to see all the time are prednisone and methylprednisolone. These are the workhorses we use when we need to calm down inflammation or dial back the immune system.
Now let's talk about these adverse effects, because the NCLEX loves them. Cushingoid features just means things like a puffy, rounded moon face, maybe a fat pad on their upper back called a buffalo hump, and weight gain around the middle. And see hyperglycemia? That's right, these drugs can seriously spike blood sugar. That's why you have to monitor their glucose, even if the patient isn't diabetic. And what do you know? There it is again, our #1 rule, never stop abruptly.
All right, let's switch gears and talk about the balance keepers, the mineralocorticoids. The main drug you'll see in this class is fludrocortisone. Its whole job is to act like the body's natural hormone aldosterone, which basically tells the kidneys, hey, hold on to salt and water.
And this slide just perfectly shows the cause and effect. I mean, think about it. If the drug is making the body hold on to sodium and water, what's going to happen? You're going to get hypertension, high blood pressure, and edema, which is just swelling. It can also make the body kick out too much potassium, leading to hypokalemia. And that is exactly why your nursing notes here are just screaming, monitor, monitor, monitor. You're watching their BP, their electrolytes, their fluid balance, everything.
Here are a few more red flags you have to know. First, patients might need a higher dose when they're stressed, like during a surgery or a bad infection, because their body can't make its own stress hormones anymore. Now, this next one is huge for exams. You cannot give these to a patient with a systemic fungal infection. Why? Because these drugs suppress the immune system, and that's the last thing you want when the body is trying to fight off a widespread infection. And of course, we're going to keep saying it, close monitoring of blood pressure, electrolytes, and fluid is just not optional.
Okay, I know that was a lot of information. So, how in the world are you going to remember all the key side effects of glucocorticoids when you're in the middle of a high-pressure exam? Don't worry, I've got you covered. Here's a super simple memory trick. To lock in the main adverse effects for drugs like prednisone, just remember the letters CPHM. C is for those cushingoid features, that moon face and buffalo hump. P is for psychiatric effects, things like mood swings or feeling agitated. H is for hyperglycemia, that spiked blood sugar. And M is for muscle wasting. CPHM. It's a really quick and easy way to remember the big four.
So, think you've got it down? Well, the only way to really know for sure is to test yourself. To really get this stuff nailed down for your exams and for your future patients, head on over to nursingwithcharity.com.ng and take the practice quiz we've set up on this exact topic. Go on, go lock it in.
And just a final reminder, please know that all the content we've talked about here is for educational purposes only. This is not medical advice. You should always seek advice from a qualified healthcare provider for any medical questions or concerns.